All right.
I will take a minute, just a minute. Huh?
Okay. So hello and welcome viewers. You're watching Business World. I'm Bhupendra Pantola. It's World Hepatitis Day today, and we have come up with this program to make the people aware about liver, disease around it, the inflammation is in liver, which is hepatitis. For this, we have two experts with us, and first we have Dr. Rajiv Lochan. He is a lead consultant, HPV and liver transplantation surgery, Manipal Hospital. We have also with us Dr. Subhashis Majumdar, Director, Gastroenterology, Hepatology, Endoscopy, Max Super Specialty Hospital. First of all, I would like to welcome my experts. Dr. Rajiv, welcome to Business World. Dr. Subhash is right now not available. He'll be with us in a while.
Thank you so much, Bhupen. It's a pleasure to be here.
Yes. All right. So as viewers, you know that liver plays a very vital role in our body, right from the metabolizing food to absorption of nutrients, to filtering blood, to basically providing an immunity, an immunization that is required to fight the infections. So it plays a very vital role. And today is World Hepatitis Day, when there is inflammation in the liver. We call it as hepatitis. And for this, we'll be discussing the holistic view, the causes, the symptoms, the cure around it. And so it's going to be a very enlightening session. I hope you all join us live. We are right now live at all our platforms in BW, Business World. So first of all, Dr. Rajiv, if you can just enlighten our viewers with what is hepatitis, how many types of hepatitis are there, and how basic, what is the overall view? Yeah.
Okay. So see, like you just said, Bhupen, hepatitis means inflammation. Anything itis, when it's added to a particular organ, it means inflammation. That's the general, descriptive term. So hepatitis means inflammation of the liver. So basically, what is inflammation? So whenever there is something which is not normal to the particular organ or tissue, and it is exposed to it, it can be a drug, it can be a toxin, it can be a microorganism. Microorganisms, as you know, are various types, viruses, bacteria, fungi, parasites, so on and so forth. COVID is a very well-known virus. We all know about it. Mm-hmm. So all these things can cause an inflammation of any particular organ. Of course, autoimmunity, our own body's immune system can attack an organ, and that can also cause inflammation. So the liver specifically is very prone to inflammation because the liver is at the center of everything in the body. The liver is the battery or the engine which drives the body. So whatever we eat or whatever it's we take in through our breath or through the skin goes into the blood, and then the blood circulates through the liver, and the toxins come into contact with the liver. And liver, as you know, is the largest organ in the body and is supplied by the portal vein and the artery. So a lot of amount of blood passes through the liver. So liver is very prone to being exposed to everything that our body is exposed to. So commonly speaking, therefore, inflammation of the liver is very, very common. So hepatitis is common. But when we speak about hepatitis, that word is used to describe a virus-related inflammation of the liver, because it's very, very common. Even when we have a common type of a common cold, the liver does get inflamed. We do not manifest it because we do not really check for the liver to be inflamed. But of course, during COVID times, for example, the liver was inflamed and a lot of people succumbed because of liver-related problems and GI-related problems, even though the COVID virus is known to affect the lung, However, World Hepatitis Day is now organized to increase awareness about inflammation of the liver caused by viruses. And there are various different types of viruses. We will not be touching on toxins, drugs, autoimmunity related problems causing inflammation, various other things, because hepatitis caused by viruses itself is such a huge problem. And there are various different types of viruses. We name them A, B, C, D, E, non-A, non-B. Dr. Shubhashi sir is there. He is a physician and hepatologist, so he'll be able to explain it in greater detail. However, there are lots of other unnamed viruses as well. Even common flu viruses, arboviruses, viruses which basically affect the intestinal tract, viruses which affect the joints, all this can also cause inflammation of the liver. But by and large, they are not such a big clinical problem in day-to-day life. And patients, it's very rare for patients to develop major liver-related issues because of GI-related virus inflammation. However, it can happen, like I mentioned about COVID earlier. It can cause huge problems. But suffice to say that today I think we're going to be focusing on the viruses related inflammation, and A, B, C, D, E, and the various other unnamed ones. And all these viruses have different types of spread. They belong to different classes of viruses, and they pose unique challenges. Some challenges can be overcome by very simple methods, and some are, even though we are fighting for decades, we have not found solution. And for one particular type of virus, there's been a magic medicine which our hepatologists use on a routine basis, so that this can be nearly be cured. And viruses can cause a lot of different types of health problems. They can cause cirrhosis, they can cause tumors, they can cause various other things which can really impact a person's longevity and health. So I think I will leave it from a surgeon's perspective. And maybe that question which you just asked me, Shubhasi sir has joined us, so he'll be able to elaborate a little bit more.
All right. All right. Understand in detail with Dr. Subhashis. Doctor, just give our viewers which, if you have to give a chronology of hepatitis A, B, C, D, E, which is the most deadliest, if you have to align them in from most deadliest to the least deadliest, and which disease in particular has the cure yet, if you can convey over that.
That's a very relevant question. In fact, when we look at these viruses, we cannot classify which is deadly or which is not deadly. We rather classify them as which viruses which cause acute infection, that is, they cause a liver inflammation, and the patient gets fully cured without leaving any long-term sequelae. Whereas few viruses, once they infect the liver, most of these patients go into a chronic phase where the disease lingers on for years, leading to other complications like a chronic liver disease, cirrhosis of liver, liver failure. Sometimes, as Dr. Rajiv also mentioned, they may also lead to hepatocellular carcinoma, that is liver cancer. So basically, we classify viruses as like just now sir said, there are many viruses which may affect the liver, but mainly the hepatotropic viruses or viruses which specifically affect the liver are five mainly: hepatitis A, B, C, D, and E. Now, what is important is the route of transmission. There are two viruses, A and E. If you look at them, they are transmitted through contaminated food, contaminated water. If the water gets contaminated, like nowadays in the rainy season. Other viruses, like the three left, B, C, and D, they are transmitted through body fluids. They may be transmitted through blood, some other body fluids. Some of them have a sexual transmission from one partner to the other. Two of these also have a vertical transmission. That is, the virus may be transmitted from the mother to the child at the time of childbirth. Now, interestingly, the viruses which are transmitted through contaminated food, they generally cause an acute infection. That is, the patient will come, he will have jaundice, yellow eyes, the liver test will be haywire, and then with conservative treatment only, none of these acute hepatitis has a specific therapy. Most of them recover. But again, when we talk about deadly virus or fatality, almost 1 to 2% of these acute infections may have a sudden liver failure, which we call as acute liver failure. These patients, almost 40 to 50% of these patients do not recover without a liver transplant. But that percentage is very low. But the three viruses which are transmitted through the body fluids, they cause chronic infection, long-term infection. Once the virus gets into your body, it is very difficult to remove them. Yes, we have a miracle drug nowadays for hepatitis C. There are various groups of drugs, which when given, we achieve more than 99% of cure rate. That is, we can eliminate the virus from the body. But one must understand, early intervention helps us, because once cirrhosis sets in, that is a chronic liver disease or an irreversible damage has been done. Even if you remove the virus, the sequelae remains. As far as hepatitis B is concerned, B and D go hand in hand. A person will have hepatitis D only if he has hepatitis B. So D sort of happens only with a B positive patient. So we treat B. And in B positive patients, most of these patients require long-term oral medications. These are simple oral tablets, 1 tablet a day, maybe long-term, which keeps the virus suppressed. But the
Okay.
elimination rate here is also very low. So both acute, the virus is transmitted through contaminated food, may cause a fatal liver disease, and this chronic viruses also may lead to cirrhosis and other complications.
All right. All right. So as you rightly mentioned that uh, B, C, and D, it can be categorized into the chronic, and A and E are the acute ones. So
I'll
we
just
need
tell you,
to.
I remember it like this, like the 5 fingers, A, B, C, D, E. So if you join our thumb and the little finger, these two are transmitted through the contaminated water. The
All
rest
right.
of the three, they cause chronic.
All right. Okay, so it's again very descriptive, and people can remember like this very well. I was reading the statistics. It said that it's around 3 crore. We have hepatitis B patients and around 70 lakhs as hepatitis C patients. What is the cure around both? If you can say, do we have a vaccine for it? Uh, your views.
Yeah, when it comes to vaccine, we have vaccines for hepatitis B, but we don't have a vaccine for hepatitis C. Yes, we have a vaccine for hepatitis A also. And the vaccine for E is still in the development phase. We are doing phase 3 trials. Even our hospital did a trial, human trial, and we have to wait for those results. So
Uh,
hepatitis B is a disease which is vaccine preventable. And nowadays in our country, it comes into the universal immunization program. Even at the time of birth, the child is given the vaccine. Usually it is only 3 doses, one today, one after a month, one after 6 months, and sometimes a booster is required. So hepatitis B is vaccine preventable, but it should be given before you have acquired the virus. At the time of birth, or if you are in a high risk profession like us who are dealing with these patients, our staff who are working in the lab, they may get contaminated. Hepatitis C does not have a vaccine, but hepatitis C has a very good treatment. Like when we talk about C has a good treatment, but with B, and once we talk about the fatality, both these diseases, when they become chronic, that is, they are present in your body for more than 6 months. But to develop cirrhosis, that is an irreversible damage, it will take years. Hepatitis B will usually take around 15 years, hepatitis C 15 to 20 years to cause an irreversible damage to the liver, which leads to cirrhosis. And once the liver becomes cirrhosis, the liver becomes stiff.
hmm.
Lot of metabolic changes, lot of vascular changes happen, which lead to jaundice, will lead to bleeding. Ultimately, many of these require a liver transplant.
Okay. Okay. I'd like to bring Dr. Rajiv back in the picture. Dr. Rajiv, if you can help us know the transplant part. I mean, what kind of medical tourism is around liver transplant in India, and any like the donation part? How can we donate our liver, and is it regenerative in nature? If you can just enlighten us over that.
Okay. So Bhupen, can I maybe talk about sort of some diagnosis and screening along with Dr. Subhashis before we go into
Exactly, sir. We should
yeah,
discuss that.
yeah,
Yeah.
yeah, with
Definitely.
your permission,
Yes, yes, please. Go ahead.
Bhupen.
Thank you.
So I think, see, sir just mentioned, see, hepatitis A and D and how fecal they come, they cause acute illness. Most of them settle down, and but they need to be treated by proper teams. And see, not all acute liver failure needs transplant. That's a very important thing which sir mentioned. So acute liver failure is when the liver is bad, really badly damaged. There is jaundice, enzymes are very high. People are
Mhm.
ill. But most of this settle down with supportive management. But in the first 1, 2, 3 days, when in the initial stages of the illness itself, most physicians, GPs, who are treating these patients, of course, some patients ended up being treated by surgeons also. So but as what is important for patients to realize, and also for the rest of the doctor community also to realize, is that when this acute illness is not settling down, they need to be sent across to a gastroenterologist, hepatologist team, so that they can be looked after. And if things are turning towards the liver failing and not being able to support the body, which is the indication for transplantation, that's a very complex situation. So
Yes.
at this time, they need to be, referred up the ladder to, if it's the government chain, up to the government hospital, or if patients are in the private sector and they need to go there, go to the nearest people. And this communication link needs to happen when the acute hepatitis sets in, and acute liver failure happens, and the need for transplantation is looming. So this is very, very important. I think everybody should realize this. Of course, there is no magic medicine for hepatitis A and D. It is only supportive care. There are no antibiotics. There is no saline drip, which is going to magically make this thing better. And most importantly, what I want to say, sir also practices, in a place where people rely very heavily on alternative systems of medicine. And this is very, very, very common. We see this very routinely. See, I work in Bangalore, and the coastal belt comes to our Manipal hospitals, and in Mysore and the southern part of Karnataka, and also the bordering districts of Tamil Nadu and Andhra, they all, I'm not blaming this on any alternative systems of medicine or anything at all. It is just that consumption of drugs, the content of which that we do not know about, and what effect it has on the liver and various other organs of the body, should be avoided during this time, because there is no medicine for acute hepatitis. The liver heals itself, and that is what makes a person get better. And our job as clinicians and medical people is to support the nutrition, make sure that they don't get infection. And if things are turning worse, we need to identify this. So this is very, very, very important. I want to mention this. I think we'll speak about some diagnosis and screening about the chronic illnesses. And if sir wants to mention one or two aspects of this, this is from a surgeon's perspective. Of course, as a physician, he would have seen many, many more patients. We only see patients who come for transplant. But I think this aspect of alternative medicine related liver, worsening, decompensation, going towards ALF, and also kidney related damage, maybe sir can maybe talk a little bit.
All right.
Thank you, Dr.
All right.
Rajiv. Yeah, Dr. Rajiv, he looked upon a very vital aspect of this thing, this hepatitis. That acute liver failure, most of them recover, but some of them who don't recover need a very critical first initial few days evaluation, management, monitoring. And if they are still failing, the liver is not picking up, they need a transplant. What sir mentioned, it is very important we understand how do we diagnose diseases. When it comes to acute hepatitis, we will see patient who will come to us with jaundice, that is yellow eyes, yellow urine, maybe some mild fever, nausea, decreased appetite, vomiting, some mild abdominal discomfort. So these patients will come to you and we diagnose, we do a few tests. These tests are mainly blood tests where we do a liver function test. We do a blood count, we look at the kidney function, and a very important test is a prothrombin time INR, which reflects the liver function. So if they are okay, we feel the patient is eating, he is fully conscious oriented, we treat them conservatively, just observe them and follow up them with tests. But a major chunk of the chronic diseases, hepatitis B and C, this chronic liver disease, they remain asymptomatic for a long time. Like if a child acquires hepatitis B from the mother, he'll be asymptomatic for next 18, 20, 25 years. Then he will become symptomatic when the liver is irreversibly damaged. So it is very important, even if during a routine checkup, we find our liver enzymes are high, say they are 1.5 times, 2 times higher. Most of our friends, our colleagues, practitioners who are practicing, they don't understand the importance of even a slightly raised SGOT, SGPT, these liver tests. Or if the ultrasound shows a fatty liver with high SGOT-PT or say echotection, most of many of us also, many of our colleagues who are not dealing with chronic liver disease every day, they just say ki this is, but actually these group of patients should be further evaluated. We should rule out a chronic hepatitis B and C in them, because if we do a timely intervention, the liver disease does not progress. We may prevent progression to cirrhosis and hepatocellular carcinoma, and also prevent the need for transplant. Because once the liver decompensates, there are various stages. We always categorize them according to the condition of the patient, according to the blood test, into various categories, child A, B, C, or there are other scorings like MELD scoring. And most of them, like Dr. Lochan said, liver disease as per we don't have any medicines to improve the liver disease. It is only supportive treatment, and the liver has to recover by itself. But in spite of everything, if the disease is progressing, the patient is continuing to have jaundice, he is having bleeding, he is not recovering, and his scores, our medical scores are deteriorating. These are the group of patients who will require transplant, and we will have to take Dr. Lochan's help here. And so that is how we diagnose. So people should have a very low threshold for looking for liver disease when it comes to the high risk group. And if the liver functions are deranged, the ultrasound is deranged. These are simple tests. And if the ultrasound is deranged, liver tests are high, we have a very simple test known as fibroscan. It is just like an ultrasound where we look at the liver and we do know the liver is stiff, it is progressing towards cirrhosis or not. Nowadays, we do liver biopsy rarely, which was earlier required to diagnose cirrhosis. Right, Dr. Rajiv, you may add on something if you like. I might have missed a few points here.
No, sir. I think that's very important to be aware about. That's in the diagnosis and screening. To be aware about the chronicity of B and C, and to identify it. And if suppose somebody has hepatitis B, what is also important is for the family members to be vaccinated. This is very important, so that you can prevent further. See, hepatitis B can be transmitted within families. Hepatitis B, if I'm not wrong, sir, hepatitis B is more transmissible than hep C. Is that right?
Yeah, it is more transmissible.
Yeah. So the chances of somebody from within the family getting affected by hepatitis B is more, whereas hepatitis C is mainly sexually transmitted, even though so sexual partners are at higher risk. But hepatitis B, it can transmit within family, within siblings, within other people living in closed families. So and we have a fantastic vaccine for it. So it's very important for them to be. So this is also very important. And also the other aspect is, if let's say suppose somebody's got early liver disease identified by fibroscan and things, screening for hepatocellular carcinoma is very important. As you know, India is going to be the future. Two problems in liver diseases are looming upon India. One is NASH, or non-alcohol. I think the name has changed now. The name has changed a little bit now. So it's metabolic associated liver disease. That is looming in India. We are going to be the Mount Kailash of metabolic associated liver disease in the coming few decades. The other problem is the increasing incidence of hepatocellular carcinoma. As we all know, we are currently upper aerodigestive tract tumors related to tobacco and lung and breast and ovary among women are higher than HCC. But in the future, in the 1 to 2, 3 decades coming, hepatocellular carcinoma incidence is going to increase and become one of the top 1 or 2 cancers in India. That is mainly because of this large group of hepatitis B undiagnosed people, youngsters and middle-aged people who were born before the vaccination era started, who are still there in the community. The hepatitis B vaccine is part of the universal immunization program in India. But there are a lot of people of my age, for example, 40s, 50s, who were not vaccinated, and a lot of people subsequently also. So all these people are now at the prime time, are in the prime time for HCC. So I think these are very important things in diagnosis and prevention and early identification of complications of chronic hepatitis. And then there is of course transplantation, which is the which is the ultimate solution for all decompensated chronic liver disease, whether it is by hepatitis B or by any other etiological factor. The end result is cirrhosis, which is hardening of the liver, causing multiple problems, causing portal hypertension by itself, and or other problems of the liver not working properly. So even that is probably the next stage of discussion.
All right. All right, Dr. Rajiv, it was, and Subhashish also, it was very, I think, holistic description that you both have presented to our viewers. I'd like to just give a summary of whatever I've understood. So we have talked about hepatitis B and C. Transmissible more is hepatitis B than C. And hepatitis B has a vaccine also. The screening part, as you have mentioned, Dr. Subhashish, is also very important. The vaccination is also very important because it can be transferred from a mother to the child also, and it leads to various other problems. And ultimate resort is liver transplant if not taken care of. Uh, Let me just get into some of the myth busters, if you allow me. Uh, it's from my experience also, personal experience also, that many times what used to happen was when we used to have somebody, cousin or sibling having jaundice, or they were prescribed, and from the family it was told ki eat boiled food, don't consume turmeric at all. Is it a myth? What is the utility of it? Because it is being practiced in many households. If you can just shed light over this.
Yeah, it is an absolute myth, and it is not in many households. Even in my family,
Yes.
my mother, my grandmother, she'll also force us to have bland food, no turmeric, no oil. What I would like to say here is once a patient has acute hepatitis, the appetite is already low. And
Absolutely.
if you are giving something which is not palatable, and there is no
Mm,
scientific basis for holding turmeric, giving a low fat diet, vegetarian, non vegetarian diet, it really doesn't matter. The patient should have a good nutrition. Even in chronic liver disease, unless there are other associated medical conditions like the patient has a lot of fluid in his tummy, he has a decreased renal function, other issues, diet is usually not restricted. And we must understand, liver is the main storage of glucose in our body. It is stored as glycogen. So whenever the body needs, the liver releases that. And with a diseased liver, this storage goes down. So a fasting, if a patient is not eating, this energy doesn't come, which is required mainly by the blood and the red blood cells on the brain. So what we prescribe is frequent small meals. So we don't have to depend on a storage. So unless the liver recovers, the patient. So there should be absolutely no restriction on any kind of diet. It should be palatable. It should be nutritious. And unless and until the patient has other comorbidities like diabetes, then we may
mm,
restrict sugar. If the patient has ascites, that is fluid in the tummy, we might have to restrict salt. But otherwise, diet plays a very vital role in the recovery of both acute and chronic liver disease. And a good nutrition is the cornerstone because we don't have any drug to recover the disease. It is the
mm.
nutrition. Sir, I'm
Uh,
sure you must be also dealing with a lot of malnourished patients who come for transplant. And sir,
Absolutely.
sarcopenia, most of them are
Yeah.
sarcopenia.
Absolutely. Yes, sir. Yeah.
And sir will know better than me. If a patient is nutritionally better, the transplant outcomes are also better.
Absolutely. Yes, sir. Yeah. Absolutely. Absolutely. I think Dr. Shubhashi said,
mm,
but just to add, the one or two things, the liver is the battery, and like sir was describing, see, it holds the glycogen, just like the battery holds the charge, and it gives out the charge until your next charge. So
mm,
when you're already ill, your charge is low, you're not able to hold. Then if you are actually going to restrict various things, how is the liver going to get charged? I think what I have found is that one of my teachers told this to me when I was training in England, and this it's not only in India. This happens across the world. This is this practice is there everywhere, and the real reason for that is because you lose your appetite. Like Dr. Subhashi said, I mean, if you give me vegetable biryani made by the best chef, or even non-veg biryani, I will not be able to eat it, and I will stop eating. And so what will happen? I will lose
mm,
weight for the next 2, 3, 4 weeks. So instead of that, our grandmothers used to give starch. They would say have some ganji, what we call in
Yeah.
from from South Karnataka, because there's a lot of starch in it, they would give sugarcane juice. Sugarcane juice is not because some sugarcane has some magic. The magic is actually the sugar which is there in it. So that is what is needed. And we've also realized, especially in transplant related outcomes, that protein is most important. So protein, if we don't take enough starch, our body's protein is broken down by the body to use for the red blood cells and for the brain, and that is why patients become sarcopenic. If you sit and talk to liver patients, you will realize that families are telling that, sir, his suit has become he's losing muscles from the shoulder, from the thighs, he's becoming thin, his tummy is becoming big, but his weight is remaining the same. That is because the water is gained and actually the muscle is gone. And so their effort tolerance, their ability to withstand an operation, all that is completely jeopardized. So in our unit, for example, we have a program which is called prehabilitation. It's not rehabilitation, it is pre. You do a prehabilitation of them before the transplant. So while they're waiting for the transplant, whether living donor or deceased donor, they are seen by our anesthetists and critical care people. They are put through moderate exercise routine along with high protein diet. So asking them to take exercises, deep breathing exercises, so much so that nowadays in our unit, patients are extubated at the end of the operation. They don't need to go on the ventilator. And this is what is happening in most. I'm sure even in SIRS unit also, this happens. This is because we all have realized that for people to come through the transplant, they need to be prepared well. So it is just like anybody. If you're going to prepare for the Wimbledon, it just got over now. I mean, I'm sure Alcazar really practiced well, isn't it? Because if not, he could not defeat Novak. I mean, it's absolute brilliant match, but I'm sure he was prepared well. The same thing for transplant also. They're very similar. And like sir said, very importantly, nutrition is the key. It is the cornerstone of all treatments for liver disease, whether for transplant or not.
Yeah.
All right, doctors. I think if we don't address this symptoms part, the discussion in itself will not be holistic. If you can just let our viewers know what are the symptoms around hepatitis. Over to you.
I will classify this into acute and chronic. When we talk about acute hepatitis, that is the liver was otherwise okay. The liver was doing well, but suddenly the virus came in and the liver got damaged. Just like malaria, typhoid, it's an acute infection. Usually in acute infection, the patient comes with a loss of appetite. He may have fever. The eyes will be yellow. The urine will be yellow. Patient comes with abdominal discomfort, nausea, vomiting, sometimes diarrhea. So this is the presentation. He comes to your OPD or your emergency, or the family is concerned. They have noticed yellow eyes. The patient doesn't have much symptoms, that he's having yellow eyes. So these are the main symptoms of acute liver disease. But when it comes to chronic liver disease, they come with these symptoms when the disease is very advanced. So I will again break it into when the liver disease is chronic, but it is not at that stage where the liver is failing really. So these patients must come with a routine blood test to you. Hey, doctor, I got a routine evaluation done and my report says my SGOT PT are high. My liver says it has a coarse echo texture. And I have a routine test which says hepatitis B is positive or hepatitis C is positive. So we have to evaluate further them. But when the disease is very advanced, like sir was saying, when we develop portal hypertension, liver becomes stiff. So what happens when we say liver disease is advanced is liver becomes stiff. So once it becomes stiff, the functions of the liver go down, like storage of glucose, development of certain proteins. Liver produces a lot of protein. And since the liver is stiff, the blood is not able to flow through the liver. So the blood looks for alternative pathways, and which leads to this bleeding. Since the pressure within this portal system, the liver vascular system is high, the patient might develop some fluid in the tummy, ascites. Nutrition becomes low. He loses weight, he loses muscles. So these patients may come with abdominal distension. There may be swelling over feet. The urine output may go down. Eyes may be yellow, urine may be yellow. They come with a hematemesis, that is blood in the vomit, or blood in stools or black colored stools. So when these symptoms happen, usually the disease is quite advanced and at an irreversible stage. Or sometimes on a routine evaluation, the patient might be quite stable, like sir was mentioning, hepatocellular carcinoma, patient with chronic hepatitis B especially, or even C.
Hmm.
We suddenly do a routine ultrasound and we see a lesion in the liver. This is a small 1 centimeter, 2 centimeter nodule in the liver. They must
Hmm.
be further evaluated with a CT scan or some blood test to know, because some of these patients, sir must be aware, if they are well compensated, the liver disease is not bad, but they have a cancer in the liver. And another interesting thing, liver cancer is the only cancer possibly which does not require a histology or a biopsy to prove it is a cancer. Only with a good CT scan or a good MRI, we may be 100% sure this is liver cancer. And if it is, and if the liver disease is advanced, he may go for transplant. And if the liver disease is not that advanced or the liver is not cirrhotic, sometimes with even a resection, the patients do well.
Yeah.
So I feel that is how the patients come to us, most of them.
Okay. So far we have talked about the viral causes, the viral sources of hepatitis. If we can just go down the line of some other health conditions like fatty liver, which is very common in India, and how alcohol affects our liver. Just an overview of you. If it's open to both of you, if you can give the overview of what needs to be done around that line.
See, as you
Please
said,
go ahead, sir. Yeah, I
and
think I think
also,
I think I think this is Dr. Shubhashi sir's sort of
sir,
forte. Yeah.
you also had touched upon this. Sir had very rightly said, NASH, like when you were saying NASH or non-alcoholic steatohepatitis. This means the name itself shows you don't drink alcohol, still you have a severe disease which is as bad as an alcoholic liver disease. Now we have changed the name to metabolic associated liver disease. So
Okay.
this is mainly related to our diet, to our lifestyle, where we have to lose weight, maintain a healthy diet. If you have associated comorbidities like diabetes, hypothyroidism, dyslipidemia, high cholesterol, we have to control those. When it comes to alcoholic liver disease, see, both these things, this NASH or non-alcoholic or fatty liver disease and alcoholic liver disease have a similar mechanism which causes damage to the liver. And higher alcoholic intake in a significant amount over a prolonged period of time leads to a similar kind of damage where the liver cells gradually become stiff, and all the problems which we see with chronic hepatitis B or C are seen here. So non-alcoholic liver disease also is as bad as hepatitis C when it comes to long-term treatment. And yes,
Okay.
alcoholic hepatitis also sometimes may present like a acute liver failure, acute alcoholic hepatitis, which is also, and we do some scorings there. And if the score is bad, almost 50% of these patients do not make it more than 1 month if it is a very severe alcoholic hepatitis. And herein what Dr. Lochen was saying, comes the role of drugs also. In our country, many people go for alternative medications, and liver is the main place where all these drugs are metabolized. So generally, if a person's liver is healthy, if I take in a lot of toxin, I'm taking Ayurveda, not exactly Ayurveda, there is a lot of cocktail going out there. So the
Hmm.
liver may be able to handle them. But with already a diseased liver, these toxins are, the liver is not able to. And even Ayurveda has a good treatment if it is taken from a proper place. There are many good Ayurvedic hospitals also, they are treating
Hmm.
liver disease. But in our country, whoever gives you anything which is cheaper, easily available, people go for it. So alcoholic liver disease, non-alcoholic liver disease, and also drug-induced liver disease are very common causes of liver damage in our country.
Okay. So as you just mentioned, it reminded me of like liver is like a CA, we can say. We just checks and audits the toxins, and in case there is a lot of toxins, then we have to pay the tax later with conditions. Before we go on to some other part, I'd like to ask about the lifestyle changes that is required, or the hepatitis, can it be also linked with diabetes? And so what should be the ideal lifestyle? in if somebody is already affected with hepatitis?
See, when we talk about hepatitis, if a patient already, like we said, even excessive weight or a fatty liver disease damages your liver, alcohol damages your liver. If a person already has a chronic hepatitis B or C, we are adding more factors by taking alcohol, by increasing weight, and we are putting more load on the liver. So now multiple factors come in and damage the liver. When it comes to lifestyle modification, if a patient has just obesity or a metabolic related liver disease, lifestyle modification is the key here, is the cornerstone, where the patient must lose weight, get back to his ideal weight. And even if he is not getting back to his ideal weight, even if he loses around 8 to 10% of his weight, we can see medical benefits. Yes, and diabetes, thyroid, dyslipidemia, these things have to be controlled very meticulously. So a good dietitian, like I said, we need to have a good dietary advice. We need to do lifestyle changes, exercises, which will ultimately lead to the betterment of the liver disease. And it only reverses what is reversible. If the patient has already an irreversible, like liver fibrosis, we do a fibroscan to look at liver fibrosis. Once the
Mhm.
fibrosis sets in, it is very difficult to reverse that.
Okay.
So, but with these changes, we have a compensated liver disease. The liver is damaged, the patient goes on, he does well. So, lifestyle modification, losing weight, nutrition, these are key for metabolic related liver disease. And of course,
Oh,
stopping alcohol for alcohol related diseases.
oh. I'd like to come back to Dr. Rajiv over what are the technological advancement that is happening in the liver transplant and surgery field. If you can just shed lights over that.
Okay. I mean, that's a very nice question. And so, see, basically, liver transplantation, the basic technique of liver transplantation is nearly unchanged since Thomas Tazel, described the procedure, many decades ago. And in India, we've been doing this for around about 2.5 decades now, and I think India has matured very nicely.
Hmm.
However, like you alluded to earlier in the talk, nearly half of these transplants happen. So, a large number of transplants happen in India, around about 2,500 to 3,000, I think, but a large,
Okay.
around about 50% of this is, happens for patients who come from outside India to undergo their transplants here, which is the medical tourism part of it. That is a very laudable thing because a lot of people consider, Indian transplant programs to deliver international level, not only transplant programs, I would say Indian liver programs, because it's not only transplantation, there's a lot of treatment around liver. There's a lot of things which
Mhm.
happen. I think programs are matured. However, 1,500, if you look at it, out of 3,000, only 1,500 transplants are done for Indians. And out of them, a small number are deceased donor programs. Whereas if you look at it in other matured and very developed healthcare systems in the world, it is the
Mhm.
other way around. Most transplants are done for their own indigenous citizens, and deceased donor, transplants form the big bulk, apart from
Mhm.
Korea and Japan, where deceased organ donations do not happen. So,
Okay.
although the lot of technology has contributed, most of the things which have resulted in the betterment of liver transplant outcomes are teamwork. This is one of the most important things which I think I should emphasize here. See, the patients are seen by physicians like Dr. Shubhishish here, gastroenterologist, hepatologist. They are managed, and for a long period of time they are identified, their family members are identified, their liver disease is managed, they are they're and they're looked after for many years, and then they decompensate some of them, and then they're referred for transplant. And then we surgeons do the inverted commas plumbing surgical bit along with our anesthetists and intensivists, and then as soon as this acute care is done, they go back to the
Mhm.
care physicians, and they are looked after so that the disease does not come back. For example, if it is hepatitis B or C, is it going to come back in the transplanted liver, or some autoimmune hepatitis is going to come back? What about weight, complications of the medicine that we are giving? All this is looked after by physicians. So this is teamwork. I think one of the best things that has happened in making transplantation successful and to international levels is the development of teams. I think this is very, very important. Of course, there are specific things like excellent, diagnostic tools like fibroscans, MRI machines,
Hmm.
and the treatment of HCC using interventional radiological techniques. ICU care has improved like anything. Patients used to be ventilated for many days. Liters of blood used to be transfused, blood products used to be transfused. All that has changed now. Transplants are done with minimal use of blood products, and transplants without the use of blood is very common, and we hardly use, and stay has reduced, and there is a lot of intraoperative technology also which has come in. For example, using microscopes to operate, surgical loops to operate, illumination to operate, and of course use of laparoscopic instruments. Robotic is a word which is being used everywhere, but that has certain limitations. As far as liver and liver transplantation is concerned, it can
Okay.
be used in certain situations, in certain specific situations. Even in our unit, we do offer robotic donor hepatectomy for certain patients, but this is by no means the standard of care. And I would like to use this platform to reach out to everybody, and say that, yes, robotic this, robotic that, artificial intelligence, this is the buzzword. And certainly transplant as we do it today, as it's going to happen 50 years down the line, it's going to be completely different. It's going to completely different, but today is not the day that, see, it's very simple. Liver transplant has a 10% mortality, 5 to 10% mortality in the best of centers. So if 10 people undergo transplant, one of them, the transplant will not be successful for whatever cause. So our aim is to make even this 1% go away and try and get to 100% safety. So that has to be the important thing for a person who is looking for many
Hmm.
decades of life, because that is what transplant is going to give to him, and to the living donor who is going to donate a part of their liver. Our job as, see, before clinicians, we are all counselors. So before a surgeon, I'm a clinician. Before a clinician, I'm a counselor. That's the same with sir too. So as a counselor, how are we going to counsel patients? Counsel
Right.
means to give the best possible advice. Is that, we got to give them the best possible treatment option available and the safest possible for both people. So I think robotics is there. It is going to be there with us, and it's going to increase. And certainly, 2 3 generation surgeons down the line, they're going to be doing it very differently. But today, I would say that, all these technological innovations which are tested and time tested and tried and successful should be used in transplant. A lot of advances are being done for robotic donor hepatectomies and
Hmm.
robotic implant as well. They're trying to do robotic implantation as well. It's being done in India as well. But these are all very laudable and they will come to fruition. But I'm like the authors of all these papers and units also say, they should be selected very, very carefully, and that is what is happening. So my counsel to all patients would be not to look for these these sort of fringe benefits more than the core benefit, which is a safe and smooth transplant, which is going to relate in 0% risk to the donor and as maximum benefit as possible to the recipient. That should be our aim.
Okay.
And this
Okay.
just briefly about the, I think the technological things. If there's any particular aspect, I'm sure we both will be able to discuss that.
Okay. Okay. So the core thing is that the ultimate benefit should be for the patient. I'll get back to Dr. Subhash. Dr. Subhash, my question to you next is not with respect to the layman, but with respect to the doctors, your fellow doctors. What should be the mindset of a doctor while treating hepatitis? Any advancement in molecular biology, and um, so if you can just enlighten your fellow doctors.
See, as far as the management or treatment of chronic hepatitis goes, yes, we have got medicines for hepatitis B, which when given the virus remains suppressed and the complications because of hepatitis B, like a chronic liver disease, progression to hepatocellular cancer, that is preventable, that is reduced. As far as hepatitis C is concerned, before the onset of cirrhosis, if they are treated, the virus gets out of the body, we can remove the virus from the body, and the patient does not progress to cirrhosis. Yes, there is some risk of hepatocellular, they might need some kind of a screening every year, every 2 years. But this is the main treatment. So the treatment, these two diseases were earlier considered as not treatable. Like earlier, when I was a resident, people used to say you get hepatitis B, C, and you get a warrant ki you are gone for life. The family used to cry and the mourning used to start. But now it has changed. And even if the patient develops they develop a chronic liver disease, we have got very good modalities to reverse the progression, to decrease the rate of progression. And yes, lastly, transplantation. The transplant has changed tremendously. Like sir was saying, nowadays, 5%, 10% complication rate is a very less complication rate. The technology has changed. And one must understand, without transplant, there is almost 100% risk of mortality in that group of patients. And with a transplant, we are giving them just a 5% mortality. And we are giving them a big hope that they will lead a further life. I'd like to say here, even my fellow physicians, some of them who are not actively dealing with liver transplantation, hepatobiliary surgery, or gastroenterology, they also don't understand this. They also say, yeah, liver transplant results are not good. So this also demotivates the patients. And sometimes as clinicians, as physicians, as sir said, we are more of a clinician. Prior to that, I'm a counselor. The patient looks up to us for giving him that small push towards a transplant or towards taking a proper treatment, not going in for alternative medicines. Patients are always in a dilemma. They have to be given that confidence. We must infuse that confidence that a transplant will help you. Nothing will happen to the donor. Most of them are worried. What will happen to my son if he gives me a liver? What will happen to my daughter? What will happen to my wife? Nothing happens. Most of the donors, the donor complication rate is very negligible. If you are giving them hope, so as physicians, we should all promote the safety of the transplant and the requirement of a proper treatment, as well as make people aware the organ donation, which is lacking in our country, should be promoted. Thirdly, I will say, as physicians, what our unit starts doing is whenever we see a young cirrhotic or a young alcoholic patient, we always counsel them. Our counselor talks with them, and we always tell them to take a good medical policy. Everybody should be insured.
Yes.
We promote them to do at least a 20, 25, 30 lakhs policy, which they may require after 10, 15 years when the disease progresses. So these are few things, small things, but as clinicians, as physicians, gastroenterologists, surgeons, when we tell the patient, they understand it better. So sometimes they are in a dilemma whether to get a transplant or not get a transplant. I think as clinicians, we must give them that push towards the right direction. Yes, go for it.
Okay. So, doctor, I'd like to connect my next question to the thing that you have said earlier. You have mentioned that hepatitis B, C, and D, they are usually transmissible through fluids. And in the household also, one should be very much watchful and mindful that he or she doesn't get infected by it. So what are the key things that one should be aware of in the household thing? How can it be transmissible? Because fluid can be saliva, it can be lots of things. So if you can just pinpoint that.
See, when we talk about body fluids, hepatitis B and C both are transmitted through body fluids, but it is not transmitted with intact mucosa or intact skin. Like if I am eating and I've got an intact mucosa, it should not transmit like this. And living in the same family leads to multiple contacts, like we are coming in and there might be some leakage. We might have a small cut which will transmit. So what Dr. Lochan had earlier mentioned, a very vital thing for hepatitis B patient is get the rest of the family vaccinated. This is an excellent vaccine with a very high rate of protection. When it comes to hepatitis C and B, since we talk about body fluids, it is mainly blood or other things. So there are certain things in a family they share. Like usually we don't share our toothbrushes. We don't share our razors. But the comb we use for hair is usually shared between family members. So I always tell them, don't even share your comb with your other family members. There are going to be micro abrasions in the scalp, and with repeated use, it may spread. So it is very necessary. Some of the personal things like brush, razor, comb, and other things should not be shared.
Hmm.
After going to toilet and all, it should be cleaned nicely. They might use some disinfectant. And of course, where it is possible, if it is hepatitis B, the family should be vaccinated.
Okay.
So these are
So I
few
was
things.
watching. Yeah.
And also the screening part. Say one family member is C. We did a study near Meerut where we saw if two non-related families have hepatitis C positive and the whole village is screened,
Hmm.
almost 40 to 50% of them come out to be hepatitis C positive. If two non-related family members or two non-related families come C. So a screening program is also required where the family, the rest of the neighbors are screened, and where possible they may be vaccinated or they may be picked up at an early stage of cirrhosis or before the cirrhosis sets in, and we may start a proper treatment.
Okay. And this screening part is also required for the ones who had already taken the vaccination, or they don't need to get this
Not
screening again.
not really. If you are already vaccinated, but you want to check whether your immunities have reached that level, we do an antibody test. And if it is okay, the patient doesn't even need a booster. If the antibody levels are low, we just give one shot of vaccine again, so that acts as a booster. This is only for hepatitis B. For hepatitis C, we don't have a vaccine. So screening programs are required because we have got a very good management for it. The drugs for hepatitis C are very good. So a screening program will work more for a hepatitis C group. B also screening plus vaccination is required.
Okay. Okay, so I'd like to ask Dr. Rajiv that lately I was watching a movie called Udta Punjab, and this got me to thinking that the IV drugs that people consume, or are they can they also be act as a source for
Yeah,
transmission?
absolutely, absolutely. See, if you look at it, historically, the southern part of Europe did not have much hepatitis B. But what happened was they were all during the Second World War, a lot of soldiers were vaccinated, and they
Okay.
used the same needle. They were all apparently given BCG. And that is why the southern part of Europe, especially Italy, if you'll see a lot of hepatitis B papers come out from Italy and all those type of areas, and also the famous classification for HCC comes out from southern Europe. So incidence of HCC there started due to hepatitis B, which was spread with needles, but that was given as a part of mass vaccination of army recruits. So same thing
Mhm.
holds good in India as well. See, in parts of Karnataka and also southern Maharashtra and Madhya Pradesh also, sir will also know there is a lot of hepatitis C because there is a lot of IV drug abuse there. Same thing in some certain parts of India, you will see that hepatitis C is clustered in these type of areas. So, I mean, hepatitis B and C both can be spread by, body fluids, blood, and IV drug abuse. Unfortunately, in India is on the increase, and certain parts are more affected than others, and certainly the metropolises are more than than the rural areas, although in rural areas also it is increasing, but the type of drugs they use there are slightly different. So I think that is very, very important. It's a growing problem, and yes, it has to be, but I mean, unfortunately, it's not one amongst the important ones that the government is looking at or addressing. But certainly, IV drug abuse plays a big role, and sharing needles. So in other parts of the world, people, when they identify people who are addicted, they go and give them needles to use so that they don't share needles, at least because
Yeah.
they know that breaking the addiction long will take a long period of time, but at least they don't get hepatitis C or B or other types of problems, including HIV, during the sharing of needles. Yeah.
All right. All right. This Urta Punjab thing remind me of another Bollywood dialogue from Shah Rukh Khan. It's famously called कि हम एक बार जीते हैं और प्यार भी एक बार होती है. But I like to take it in terms of the theme of World Hepatitis Day. One life, one liver. Any final message as we are approaching towards the end of our segment? Any final message on the theme of World Hepatitis Day? Uh, both of you can convey.
Okay. See, this World Hepatitis Day is celebrated, or the basic purpose is to spread the awareness among people, among my fellow colleagues and the general public. What is hepatitis? Hepatitis is inflammation of the liver. And the best way to keep the liver healthy is to not do things which will harm it. Not take IV drugs, not take alcohol, maintain a healthy lifestyle, not gain weight. And if at all the liver is damaged because of some reason, we acquire hepatitis B and C, we should seek proper medical advice, get an early diagnosis, and get a proper treatment. So awareness about liver is very important. Lastly, our relatives, our colleagues, our neighbors, our countrymen who are suffering from this chronic liver disease, who need a transplant, they will be immensely benefited if all of us can donate our organs. Once we are not here, we can continue to live with them by donating organs. And one donation will help 8 lives. And one of them is just liver. One donation helps 8 lives. So my message will be, we should prevent liver disease if at all diagnosed, get for an early diagnosis treatment, and all of us should pledge for organ donation. Sir, what is your take on this? Yeah.
Absolutely, sir. I completely support what sir said. I think, see, we should move towards making transplantation affordable so that at least a decade from now, we are saying that the vast majority are done for Indian citizens in India, although we are very happy to do transplants for people who come from other parts of the world. But it's always a constant reminder that, taking out insurances, making transplant affordable, all these will go a long way towards that. And donating organs is, I think, most important. And I think I don't think any religion prohibits it. And most religions express great admiration, like, for example, Dadichi, our great ancient rishi, who donated his bones to make the vajra to actually destroy the demons. I think organ donation, it will play a big role. I think that's very, very important. And like sir said, I'd like to say, yes, see, we all know what is good for the heart. So we exercise, we do that, we do this diet, this, that, the other. But actually, if you look at it very carefully, what is good for the heart is better for the liver. So if you look after your battery, so your transmission and your pump, your engine oil pump, your carburetor pump, everything will be fantastic. So look after your battery, which is the liver. So what is good for the heart, what is good for the liver is better for the heart. I'd like to say this to everybody who's listening to this, and do look after your liver. एक जिंदगी है, एक प्यार है, एक ही यकृत है. इसका अच्छे से इस्तेमाल कीजिए और जिंदगी जिए.
Definite. So final takeaway is अपने liver को आप donate करें, because then you won't just be giving a liver to somebody, you will be giving a life to somebody, and that is what matters. Thank you so much, Dr. Subhashis and Dr. Rajiv, for talking to us. It was very enlightening. It was very holistic discussion. I'm sure the people who were watching this must have been benefited like anything from this discussion. All the people, not just the one who are already in the grasp of hepatitis B or C, but people in general would have been. Thank you so much for being a part of this discussion.
Thank you, Pinder. And thank you, sir. It was lovely meeting. Hope we meet someday when I come to
Bangalore. Sure, sir. I do look forward to meeting you too, sir. Thank you so much, Dr. Subhashis, sir. Bhupender, thank you so much. Thank you, BW team. Thank you.
Thank you.
Thank you.